Concussions in athletics has been at the forefront of the news recently, not just at the professional level, but especially within youth sports. I'm here with Assistant Professor Michael Frass, who works in the Communications, Sciences, and Disorders Department here at Western, who's been working on this very issue in young athletes sustaining concussions, and he's here with us in the studio today. So thanks so much for being here with us, Michael.
Chris.
Yeah,
good to be here.
Really appreciate it. So concussions, it has been really at the forefront of the news, but I think one thing that a lot of people don't necessarily understand, and I don't understand fully, is really what a concussion is.
Yeah, well, concussion is a brain injury, and I think that is something that really needs to get across to people. It's a brain injury, and it's usually due to direct or indirect blow to the head, but it can also be a contact to the body with enough force can cause head trauma. There are about 1.6 to 3.8 million that occur each year in the United States. That's an estimate. And the CDC indicates that we don't know the exact number because people fail to report their concussions.
What are the signs? How does somebody know if they've been concussed?
Well, cognitive signs might include loss of memory or attention problems, sense of confusion, feeling slowed down. Physical symptoms would be a headache or dizziness, slowed speech. There are sensory symptoms, as like sensitivity to light or to sound. And then there are some emotional changes like irritability or moodiness, depression, anxiety.
Is there a sustained injury that can happen, or is it something that heals over time?
Yeah. Well, concussion is really a functional problem, not a structural problem, meaning that a structural problem would be actual damage to the outer part of the brain, like swelling or bleeding in the brain. And that can happen, but it's a smaller cases. What is usually happening at a functional level inside the cell is there's a change in the state of the cell. So ions flowing in and out of the cell cause the cell to be overexcited. And that cell needs energy, which comes from the blood, in order to maintain homeostasis in the cell. However, after a concussion, there's actually a drop in cerebral blood flow that can last for 7 to 10 days. So in that period of time, the brain is very vulnerable to a second impact. Most people will recover within that 7 to 10 days, sometimes much quicker than that. Others may persist for weeks, months, even years. If that symptom persistence goes on for over a month, we would say they have a post-concussion syndrome, and that really has a big impact on getting back into the classroom and functioning effectively on a day-to-day basis.
Do you think enough's being done to protect our student athletes?
Well, back in 2009, Washington was the first state in the country to pass legislation to protect youth athletes from concussion. This was known as the Zachary-Lystead Law. And it had 3 tenets. The first being that if a child is suspected of having a concussion, they'd be removed from the game immediately and not returned to the game. Then they need to be cleared by a trained medical professional who signs off on their recovery before they're able to return to play. And the most important aspect of that, I think, is also the education to parents and coaches and players on what is a concussion and what are the symptoms and how it's best managed. While that has been in effect in Washington since then, and all 50 states now have legislation that is very similar, I don't think it's being carried out in the way that it should. And there hasn't been a lot of talk about how to effectively return an athlete to the classroom. We have clear return to play guidelines that have a step-by-step process for getting the athlete back onto the playing field, but very little about how to get them back into the classroom successfully. And we're finding that once they're asymptomatic, they go back to full-time education right away, and they're unable to handle it and they break down. But because there's no outward symptoms, they look fine, there's no visual injury going on, people have a hard time understanding why they are struggling where before they had no problem. And the athlete themselves is confused by that, and that helps to perseverate emotional problems like depression and anxiety.
I wanted to go back to the return to learn concept, because obviously at the pro athlete level, they're not going back to the classroom necessarily. They're going back to families and things like that.
Mm-hmm.
But with youth sports playing such a major role, especially in the high school and collegiate level, what do you suggest? What do you think could be some possible solutions to help students get back into the classroom after a concussion?
Well, if you think about all the demands that kids, like high school kids, have to deal with on a daily basis, there's a lot of physical demand. There are, of course, the academic demands of sitting in the classroom and note-taking and studying for exams and completing exams and assignments on a timely basis. And if you throw a child right back into that situation for a full day, it's a good possibility that they're going to fail. And so some people have been looking at this issue and see the need to have a graded return to learn policy in place. So you start off slowly easing the child back into the classroom. Maybe they start with one class a day. If they're asymptomatic after that, then maybe they can progress to 2 classes. Other things like other sensory issues like screen time, so on a computer or using their smartphone, that can also exacerbate a concussion. So easing back into use of those types of devices.
So do you have an opportunity to work with Western's athletes on campus, whether it be at the intercollegiate level or in the club sports or intramurals?
Yeah, I've been working with one athlete, one student from Western in particular, who came to me with symptoms of post-concussion syndrome. These concussion symptoms had been lasting for over a month, and he had about 5 concussions in a period of 6 months.
Wow.
And so he came to our clinic, the Speech, Language, and Hearing Clinic here on Western's campus, under the direction of myself and my colleague Leslie Stevens, and working with graduate student clinicians. We set up a program for him where we addressed some attention problems, and we helped him organize and try to prepare himself to be more effective in the classroom. And he started to benefit from that. We did some neuropsych testing on him and found that indeed, after working with us for a couple of quarters, he is making some progress, and it's been great to see that. But of course, he's very frustrated with the situation.
Are you working with other students from the research level? I mean, I know one of the real strengths to Western is that our undergraduates get some really cool opportunities to work with faculty like yourself.
Yeah, sure. In my lab, we're starting to look at changes in speech function. So we collect baseline data at the start of the season, giving the athletes a few little speech tasks to perform. And if they are concussed, they report back to us, hopefully within 24 to 48 hours, and we record their speech again and then look to see what's going on. Juliana Dubergo, who was a graduate student of mine last year, she found that there are indeed some measurable changes in speech function in the concussed athlete. And so we, of course, need to collect a lot more data to know exactly what's going on, but could have some implications for diagnosing and making return to play and return to learn possible.
And what can families do to help educate their kids, or at least help prevent their kids from getting concussions?
I don't think people need to start panicking and pulling their kids out of sport. What they need to do is start asking questions like, how are injuries being managed? Who's managing these injuries? What mechanisms are in place for safely returning my child to sport, or more importantly, to the classroom? So education is certainly a key. We also need to change the culture within sport. So, I know when I was growing up, the culture was, okay, shake it off, get back in there. And this is the problem for long-term types of injuries. Coaches need to be more aware of these injuries, and they need to be more responsible in how their athletes are managed.
Well, Michael, thank you so very much for being here.
Yeah,
Really do
great to be
appreciate
here,
it.
Chris.
And
Thank
we're
you.
really lucky to have people like you working at Western and working with our students. We're really fortunate to have that.
Thank you very much. Good
Thank
to
you.
be here.
Dr. Michael Frass in Western's Communications, Sciences, and Disorders.
Best students are those who come to the field because they are extremely passionate about understanding how the central nervous system functions.
Nerds started before I was an undergraduate at Western. I was still a little stem cell when the nerds were getting started. It stands for Neuroscience Research Driven Students,